Good morning, everyone, and so welcome to the fourth talk in the morning session. And this speaker is Professor Rajesh Sundaresan, who is a professor at the Institute of Science in the Department of Electrical Communication Engineering, and also a faculty at the Robert Bosch Center for Cyber-Physical Systems. And he received his PhD in electrical engineering from Princeton in '99, and built communication modems at Qualcomm until 2005, and has been at IIC since 2005. Except for brief visits to Qualcomm, the University of Illinois at Urbana-Champaign, and the Toulouse Mathematical Institute. And I'm also happy to say he's an alum of IIT Madras. And his research interests are in communications, computation, and control over networks with application to cyber-physical systems. So over to you, Rajesh.
Thank you. I hope you're able to hear me. Yes. Let me share my screen. Are you able to see my screen?
Yes, Rajesh, you can go ahead.
Thank you. Hello, everyone. I'm going to speak about city-scale agent-based simulator for modeling COVID-19 spread. So I'm Rajesh Sundaresan. As Ravi said, I'm from the ECE department at the Indian Institute of Science. I'm also at the Robert Bosch Center for Cyber-Physical Systems. I'm an associate faculty there. And I'm also involved with the Center for Network Intelligence at the Indian Institute of Science. Currently, I'm visiting Strand Life Sciences. What I'm going to speak today is about a joint effort with TIFR Mumbai colleagues. This is how COVID-19 has panned out in India. So we had this lockdown on the 25th of March, and that did slow things down a bit. But the spread has been significant despite the lockdown, and as of 27th of August, we have had about 60,000 deceased individuals. So this data is taken from Shiva Atreya's plots in ISI, so you can do a web search for in COVID-19 ISI, and you'll get a wealth of information about Karnataka and how it has tackled COVID-19. So a lot of people have responded in a hugely positive way to tackle this particular pandemic, and these are some of our responses. So today I will speak about the agent-based city-scale simulator. It's actually an open source simulation tool that we have put out. So it's an open source simulator tool that we have put out, and you can go to this website and you'll be able to see it. We also have two other tools. One is a workplace readiness indicator, and the other one is about how to move swaps efficiently to labs. And for those who are in the industry, if you'd like to use this particular tool, it's called it's the workplace readiness tool. It's like an Arogya Setu for companies. So I encourage you to go and take a look at it and see if you can enter data about your company and get a feel for how ready your workplace is. So for whom have we been building these tools? It's largely for city and state administrators, Karnataka State Disaster Management Authority and the Brihan Mumbai Municipal Corporation. Also, we have been we've built this tool for organizations like micro, small, medium-scale industries, government offices, IT offices. We've also built tools for the Karnataka Health Department. The swaps to labs tools is essentially for them. And I'll speak about two studies. I'll begin with the Mumbai containment zone and trains opening study. And then towards the end, I'll speak about opening of schools in Bangalore. So here is a kind of study that our team, our colleagues from TIFR have done. It's about the effectiveness of containment and opening up of trains, when to open trains, and what would be the impact of trains. So just a quick overview of what the study is about. So imagine that there is a COVID positive case in your community, and that particular person will now be asked to isolate himself or herself. And then there would be a sort of containment that would come around. So let's say that it's around 100-meter area around this particular individual. The containment is sort of proportional to the number that are hospitalized in this area. So if there are more people, so let's say if there are 2 people, then there is stricter containment. But if there is only 1, there is a somewhat relaxed containment. Let's say that how the effectiveness of the containment is measured by the extent to which the mobility is reduced. And so if only 3 out of nominally 4 movements are allowed, then we say that there is about 25% containment. If 3 out of 4 movements are constrained, there is 75% containment effectiveness. And similarly, there could be lower levels of effectiveness. What if the containment effectiveness is not 75% but 60%? So how would the disease spread? So this is something that we would like to study. And then another one is how to manage infections coming from transport when trains are opened up. We might want to open up the economy gradually, and we might want to see at what level we should open up the trains. That's a way of managing this. So what if we open trains up at 30% in September, 60% in October, and 100% in November? Offices would then be similarly opened, and we would also like to stagger office times and so on. So use shifts to aid in social distancing precautions. But what if the trains interactions that we have in our model is at some base level versus 50% more interaction? So we would like to understand how the model would pan out, and then try to make sense of whether this is a good method to open up or not. And so here are some predictions for Mumbai and the various levels of containment effectiveness and train contact levels. So there are 4 curves that you will see here. So the first, the orange ones correspond to 60% containment effectiveness, whereas the blue ones correspond to 75% containment effectiveness. And then you will also see a dotted line and a dashed line. The dotted line corresponds to higher levels of train contacts, whereas the dashed line corresponds to base levels of train contacts. And so you can see that these are the possible predictions of how things might pan out, starting from, let's say, this point onwards. And the actual number of cases are plotted here. So what we have tried to do is we have tried to match the data up to somewhere here, and then we have let it evolve. And these are sort of predictions. So a city planner can take a look at these and decide to what extent the economy can be opened up and things like that. This is as far as predictions for the number of positive cases is concerned. This is the number of fatalities, and there is a good match with respect to fatalities. Now, how do we do all of these things? And that's what we're going to discuss. So while we eagerly await vaccines, we have turned to timely case identification, case management via isolation, monitoring, and treatment, and also other non-pharmaceutical interventions for addressing the pandemic. And simulations can help us with scenario exploration and the kind of decision making that I just explained a few slides back. So today's discussion is going to be about agent-based simulator, and also I'm going to describe a second outcome, our study on Bengaluru. Okay, so what are agent-based simulators that enable such studies? So let's just break this down into these components. So first we create a sort of synthetic population of agents in the city. Then we model disease dynamics, and then we model interventions. And then finally we simulate the spread of a hypothetical disease in the synthetic population via some stochastic methodologies. So here is Bangalore on the left side and Mumbai on the right side, and Bangalore's 198 wards are actually color-coded according to the number of people in that particular ward. So the more people in a particular ward, the darker the color. So about 1. Live in Bangalore, and 1.24 crore agents live in this Mumbai region called the Brihan Mumbai Municipal Corporation. So as you can see here, there's quite a bit of variability of population density in Bangalore as well as in Mumbai. So one must take this into account when one models disease spread. So what we do is we actually rely quite a bit on census data, population information, age information, gender, whether they are employed or not, and things like that. So there's quite a bit of curation of the data that happens. And then we also look at geographic information systems and the data that they can supply. Then the curation that I spoke about. And eventually what we do is, through some high performance computing capability, we come up with a synthetic city with a digital twin for every individual in the city. And so if there are 1.23 crore agents in Bangalore, then we have 1.23 crore agents in our synthetic city as well. We also build a lot of these activity places, like for example, the typical household size in Bangalore is 4. So that means 1.23 crore divided by 4, that many number of households are there. And that's also something that is instantiated. Children of school going age have to go to schools. People that go to work have to go to work, and so on. So we instantiate all of these things respecting the transport metrics. For example, our transportation department at the Indian Institute of Science conducted some surveys, and we have origin destination matrices which sort of tell what the intensity of travel is from a particular ward, starting from a particular ward and ending in a particular ward. So all of these are actually used to create as realistic a city as possible. We also model factories. To some extent, we model hospitals, market areas, and so on. And so here are individuals on one side, 1.23 crore agents. Here are various such places that they are associated with. And what happens is that these interactions are modeled, and the modeling then looks at how the disease spreads in these interaction spaces. So here is a more abstract way of representing it. So really what's happening is there are multiple social networks. So here are individuals in these dark circles. These blue ones correspond to households. So that's a social interaction network. We know that the disease spreads, COVID-19 particularly in such close contact environments, so homes, offices, and so on. So similarly, this is a household with 4 people and so on. So these individuals may possibly go to the same workplace, and so they would have another network interaction space, and that would be a workplace. And these individuals could be going to schools. All of these may go to markets to make purchases and so on, so there's going to be a market interaction space. They might use public transportation or possible other transportation, so then there is an interaction space there as well. So abstractly, these are bipartite graphs. So here are the individuals. Here is one bipartite graph which sort of tells what the school interaction is. So everybody in a particular school, going to a particular school, individuals here going to a particular school will all be connected to that. Individuals going to another school will all be connected to that, and so on. And similarly for workplaces, homes, and so on. Now, there are also scales of interaction. So for example, you might go to your workplace, but you don't interact with everybody in your large office, which might have 1,000 people. So your interaction may be with a small project group. So that is also modeled in this agent-based simulator. Similarly, if you go to if somebody is of school-going age, their interactions is largely with people in their class rather than others. So it doesn't mean that there is no interaction with the others, but it's just limited. There is a concentrated interaction with people in their class. There is also similar age-structured stratification of interactions that one can bring about, one should bring about, and all these matter in terms of trying to understand how different groups might be impacted. Now, this is a comparison of our synthetic Bangalore and real Bangalore. So the data in blue corresponds to data from the real Bangalore. So on this axis we see the age, and on this axis we see the age density. And the red one is essentially our instantiation, and there's a good match here. This one is household sizes distribution, and blue one is the actual data, the red one is our synthetic city. This is actually workplace size. And as you can see, the blue is this, that's a fit to the actual data, but the red one is something that is somewhat noisy. That's because we don't have good fit for very large workplaces, but it seems to be roughly following the trend. And here is workplace distance, commute distances. So the blue once again is the actual data, and the red is our model. And finally, school sizes are also here, blue for the actual data and red for a fit. Okay, after creating the synthetic city, one also needs, with various social networks, one also needs to understand the biology a bit. So the biology goes as follows. This is how the infection spreads in a particular individual. So once a person is exposed, there's an incubation period. This incubation period is about 4.5 days. Then the person may have a sufficient viral load that he might start shedding this virus. This might be before the person start showing symptoms, so they would be pre-symptomatic. Or alternatively, they might be able to successfully fight the virus. They don't show any symptoms at all, but nevertheless they might be spreading symptoms, and that is believed to be one of the key differences with respect to other viruses. And then in COVID-19. And then once one shows symptoms, there could be a varying profile of spread. That's typically believed to be about, it's random, but the mean is around 5 days. And then some people recover, but certain others, and this is possibly dependent on the age, there's an age-dependent branching, they may need additional hospital care. And they might be successful, certain others may need additional care and then recover, or perhaps they may pass away. Also, one needs to take into account individual factors such as comorbidities, and if you have an agent-based simulator, that variation within that individual can be easily found. Okay, so this is the data that one uses, or data like this. This is some very early data to understand what kind of hospitalization requirements. What are the hospitalization requirements for people in these various age groups? And here is data about comorbidities as well. So one uses all of this and then builds an interaction network. So this is probably the only equation that I will have. And my intention is for you to see the various interaction spaces, but not worry about the actual equations. So this is the rate at which a person, an individual n at a time t, will get infected, and it depends on the infectivity at home, and that depends on all the individuals that are connected to that particular home. That affects this particular individual's infectivity, but he might get infected in this larger neighborhood. For example, if I live in an apartment complex and there is somebody in my apartment complex who might be positive, then there is some interaction with individuals there, and the spread might happen because of that. Friends and family across the city, interactions at school, interactions within a class, interaction at the workplace, interaction within the group, and interaction in the transport spaces and markets, restaurants, etc. You will see that there is actually a larger interaction space and then a closer interaction space. A larger interaction space in the wider community and a closer interaction space with respect to friends and family. Larger interaction space in the school, within a class, workplace, within a group, and so on. Now, it's important to model this because I think these things are closer to reality, and the disease spread is largely in such close interaction spaces. This agent-based model also brings in spatial heterogeneity in a very natural way. So you will commute from your home to work, and that particular spread is a long distance spread, and that's being modeled despite your contacts being somewhat local, but your mobility then takes your infection from one location to another. So the connectivity due to daily mobility is automatically taken into account when you build such a city model and build activities on it. But most importantly, it enables study of targeted interventions, for example, case isolation, home quarantining, social effectiveness of social distancing of the elderly, school closures, and also of the studies of the type that I mentioned, phased opening of transport, containment zone, offices, schools, etc. So here is one example of a model and study of voluntary home quarantine. And one could specify voluntary home quarantine in this way. Following identification of a symptomatic case, so in our simulator, we should track this symptomatic case and assume that that person recognizes that he has symptoms, and then he voluntarily stays at his home. So identification of symptomatic case in the household, all household members remain home for 14 days. Household contact rates then will double because they are all at home, but contacts in the community are reduced by a certain factor. It reduces to maybe only one person out of the 4 in the home goes out to get essential supplies, and so it's 1 in 4. That's a 75% reduction. And not everybody complies, so let's say a certain fraction complies with this, and that would be a compliance factor as well. So this is how one would program this in our simulator. Also, what's the impact of quarantine that's induced by contact tracing? This is believed to be one of the most effective ways of containing epidemics. And so once you identify a certain person who's positive with this disease, all his immediate contacts in the workplace are asked to quarantine themselves, and people in their homes. Or if it is in school, all members of the same classroom are asked to quarantine themselves. And so with this, one could bring in such quarantining and see how the infection spreads as a consequence of this quarantining, and then study the effectiveness of this policy. Okay, there is one, as you would have noticed, there are quite a few parameters that one needs to set in our system. And there is an issue related to calibration. I'll speak about that very briefly. The way we do it is as follows. So we actually seed in our simulator 100 infections at a certain point of time. And then we let it spread. When we then look at individuals that enter the hospitals and eventually some of them may pass away, we look at that data. So that's our simulated data, and we match it with all the fatalities in India up to April 9 brought to one particular city. And so those are the black dots, and this is what our simulator would give. Now, of course, for different parameters, you would see different growth rates, but we try to match it so that it aligns with this. And that is pre-lockdown. So the effect of lockdown on fatalities, to reduce the fatalities, was seen only after about April 15th or so, because of the long incubation period and the long hospitalization period and so on. And so this data is basically as yet unaffected by lockdown, and so one could use this to calibrate the simulator. Also, there are prior studies that suggest that the infection rates in previous flu situations are 1/3 from home, 1/3 from workplace, and 1/3 from school, so one could calibrate to things like that as well. And then we later calibrate compliance level to match to subsequent growth rates. Now, agent-based models, it is said, can be calibrated to say anything, but in defense of agent-based models, they are actually constructed bottom-up, so from city census data. So these are not things that we tune. The disease parameters come from clinical studies. Past flu cohort studies suggest relationship between school and office contact rates, and so on. So the number of parameters that we actually calibrate are only a few comparatively compared to the large number of other fixed parameters that we use. So here are three interesting agent-based simulators that were studied as far back as 2008 in a hypothetical context where they tried to look at some simple situations, non-pharmaceutical interventions, and then they also looked at antiviral prophylaxis. And you can see that they roughly, there are differences, and there are interesting insights you can get by studying those differences, but you can actually see that they sort of agree with each other. At least two of them agree compared to the third. In on some occasions, these two will agree, but on some other occasions, some other interventions, certain others will agree. And then one could study why they differ and get more insight. Now, I'll quickly finish with a second set of simulation studies that we have done, which is related to not 1 week lockdown, but school openings in Bangalore. So here is actually the timeline of various interventions across Bangalore. So no intervention, there was a pre-lockdown period. Bangalore started early on this lockdown business, and we closed things down on the 13th of March. And then the national lockdown, a partial unlock in May, and then subsequent unlock 1, unlock 2, and things like that. Now, there was a very brief period when we had a 1 week lockdown. So let's just look at only this particular scenario, and then a partial unlock, and then now we are back to the same unlock in sync with the rest of the nation. So here is a more detailed indication of exactly how that is coded. So for example, masks, when lockdown is on, a lot of contact rates will come down. When masks are on, the spread reduces by 20% in one way. But if both the giver and the receiver wear masks, then the contact rates go down even further. So we model all of these things, and then we do what is called ward containment, and I spoke about that in the first few slides. And here is what we have for two scenarios. This is Bangalore with no schools, and Bangalore with the schools reopening on the September 1st. And one can look at how the simulation will evolve, and then assess to what extent the infection may spread if schools reopen. And then this can be used as a policy guide. Okay, I'll now summarize and finish. So we looked at agent-based models for COVID-19. We can model heterogeneity at the individual level. We can bring in behavioral adaptations. Behavioral adaptations because of increased knowledge or increased information about the pandemic. Masks wearing, for example, is one such. But maybe there is lockdown fatigue as well. One could model that. In fact, in the Bangalore situation, we have actually modeled lockdown fatigue as well. We can model heterogeneity in the interactions. So there are tighter networks where you interact a lot more, and then somewhat broader interactions with the wider community. This happens at home, in your apartment complexes or community neighborhood, at workplaces, at schools, and things like that. Then I described how interventions could be modeled and how it could be used to study the effectiveness of various interventions. In the future, we plan to bring in testing strategies, come up with better testing strategies, or at least evaluate the effectiveness of various testing strategies, maybe vaccination prioritization, and so on. So I highlighted in this particular in this particular talk, trains restart and schools restart. Trains restart was in the Mumbai context because trains are the lifeline of Mumbai's economy, and schools is because that's a question in every academic's mind. Its agent-based simulators are very useful in other domains, for example, for traffic studies and so on. Also for effectiveness of the typically now on, now off, odd even strategy that seems to be popular now, and not so popular now in New Delhi. Acknowledgements. I would like to thank a huge group of people that have helped us build this particular simulator and make all these and have all these studies. Particularly, I would like to call out Cisco CSR for funding the Center for Network Intelligence and for supporting this work. Thank you.
So, thank you, Rajesh. That was a great talk, and there are a lot of questions. So let's see if we can squeeze in some questions before we run out of time. So the first question that I would like to ask is, so how granular is your model? I mean, what level of granularity can you make predictions? Can you pick a specific school in a specific locality and make predictions about that, or a bit more?
So as I said, it is a synthetic city. What we do have is there are this many. So if Bangalore has, let us say, 1,000 schools, then our synthetic city will also have 1,000 schools. It will also be similar to, the distribution will be similar to the actual distribution in Bangalore, because we do take into account in this particular ward where there are 60,000 people, there are likely to be this many children and so on. So it's at that level. But if you ask, okay, here is Sandipani Public School, do you model that? It doesn't go to that specific level. But there is an analogous entity for Sandipani Public School, which
can you take insights from the analogous entity and actually use it in the school?
No, I think the reliability of estimates that you get for one particular school will always be questionable in a simulator like this. But what you can take is, you can think of aggregate levels. Like for example, Sandipani school has 300 people, let us say. Then you can look at, in our city, all these schools with roughly 300 students and see how things have evolved in that population of schools. I think it's useful at that level.
Great. So do you have any insights about how the model parameters of these synthetic cities change for the Indian context versus something that was built for the West?
Yes. So, for example, I'll give you one specific example. So, in the West, there are elementary schools, then the middle schools, and then the high school. And then there are large universities. In our cities, typically, there is kindergarten, that's somewhat distributed. But then pretty much from 1st standard to 12th standard is all in one school. There are, of course, some schools that do only up to 6th standard, but they are fewer in number. So that's a significant difference. Also, there are our universities, our university system is with colleges and universities for higher education and research. At the college level, there is still some distributedness. So we have to take those things into account. So in that respect, it's very different. Population densities are widely different. So we have to tune it to our city. Otherwise, it will not.
And also family sizes and things like that?
Yes. Yeah. You take all this data from census. We have been able to faithfully replicate this for Bangalore and Mumbai and for one or two other cities. So New York City, for example, we have. And the evolution in New York is very different from in Bangalore and in Mumbai. We have also tried to do Wuhan, where this disease originated. but they're all still at the calibration stage. It takes quite a bit of effort to get this to a usable state.
So I have to ask you this question because it's the most upvoted question. So what is your opinion regarding holding entrance exams like NEET and JEE?
Sach bolu ya jhoot?
What does your model tell you?
What is I think this is my own personal opinion. There is a huge cost to delaying these things. I think we should take the right precautions, ensure that we are able to protect each individual, help them protect themselves, and then ensure social distancing and maybe conduct these. I think many of these activities perhaps could go on with the right protection. A lot of it will also depend on cooperation from individuals. So you do see a lot of people not wearing masks and traveling around. So I think that's an issue.
Yeah.
So one has to balance these things, and we have to find ways and means by which we can ensure compliance and try to move on. Thank you.
So thank you, Rajesh, for
my opinion.
Sure. I mean, that's what we were asking anyway. So thank you very much for the talk, and thank you for taking the questions. There are some more questions and some actually technical. If you have time, you could answer them on the window, chat window.
Okay, sure. Yeah.
Thank you again. Thanks for the question.